Hello everyone, we are here in the pre-operative arena with a patient for rhinoplasty and also for asymmetry correction. Now the asymmetry lies largely in the malar region or the cheekbone region. One look and we see that the left side of the face is a little more prominent or bulging as compared to the right side. So that has to be corrected because the malar bone is slightly symmetrical on the left as compared to the right. Also, he has had an orthognathic surgery years back, right?
12 years.
12 years back. And by orthognathic, an upper and lower jaw, a bi-jaw surgery has been done. Currently, he seeks a nose job or a rhinoplasty, and it's purely for cosmetic reasons. He sees that point in time he was not aware that a rhinoplasty existed when he went in for a jaw surgery. So we see that he has, if you look straight and we see him from the side, he has a hump which is a dorsal hump, so that needs correction. Also his nose is a little broad and flared, the width is quite a lot. He wants a nose which suits his face, which is, so as to say, more aesthetic, probably narrower dorsum. Slight augmentation will help him, a tip work and mild alar work. So he wants an overall correction for the nose, wherein there's a possibility of rib harvest. It's not very certain because he does not have any functional issues, but for cosmetic reasons. He has shown us pictures of what he desires, and we'll see how this rhinoplasty and asymmetric correction goes about. Do you have any input, sir? Would you like to add in something? Any particular change that you're looking for with the nose? No. You were told it was 12 years back, the jaw surgery. Why you did not undergo a rhinoplasty like soon after?
That time actually I'm more concentrated about the functional this one. Then that time it is not that much
you were not
familiar about it.
Okay. Okay, so you were aware of the jaw, but you were not too aware of the nose, this thing. Okay, right. And now years later that you've come to us, probably it will be a good, pleasing aesthetic nose that you desire. Yeah, thank you.
A few things for this guy. He's had jaw surgery done elsewhere. We're going to be narrowing the nose down here, removing the small hump, augmenting the malar prominence a little bit. This is the plan. I'm also going to be doing what is called as a piriformoplasty. So we're going to be working on the bone on the base of the nose. Piriform means shape of pear. So this is the shape of the bone that's actually on the upper jaw. I'll be contouring or sculpting that a little bit, and we would be trying to define his nose from inside too.
Hello everyone, here we have a patient who had come to us with concerns of a broad nose. As you can see in the pre-op, he had a broad dorsum and a bulbous tip. He had alar flaring which he wanted to be reduced. So this is his 8th day post-operative, and let's now first remove the splint so that we can see what all changes have occurred post-operatively. You have light pain?
No.
Little pain you might have. No, what's etc. Okay. Okay. This is a line. Yeah. Is it burning?
No. Only a little pain.
Okay. So as you can see, post-operative, the dorsal width was reduced and it's quite narrow now, and there was quite a lot of alar based flaring which we have reduced here, and you can see the sutures here which are present post-operatively. Apart from that, we've also done a malar augmentation with implants. So the malar region has been augmented and his face looks much more symmetric now. You can see yourself in the mirror. There is a bit of bruising here, but that will reduce, it will subside on its own.
And it's all swelling in the tip also, it will subside.
Yeah.
Normally it is after 6 months it will come the final result, or?
Yes, you will have to wait a couple of weeks, at least 1 or 2 months, you will see the results. But then in the next 6 months you will see definitive results. That's it. You would like to tell something, Anish? How was the experience? How was the surgery?
First I thought it will be a painful procedure.
Because
but
you have undergone one surgery before.
Yeah,
Years
before,
back, around 11
12
years.
years back.
12 years back,
Yeah.
and that was for the jaw surgery.
Yeah, jaw surgery.
But you told that time you were not much aware as to what rhinoplasty is
Yeah.
exactly,
Yeah,
what
yeah,
all
exactly.
changes
Yeah,
can be done.
Now feeling not that much painful. What I maybe it will be too much painful or like that. But
Right.
once the pack removed, that day itself I can breathe.
Breathing was very
Yeah.
difficult. That's a little tricky part for
Yeah.
most of the patients to breathe that way. Yeah. Just have a look at the mirror carefully now, Anish. All the changes, as much as possible, is being achieved. Your dorsum, just look at the dorsal width now.
Okay.
Right now. Yes, there is swelling everywhere. In fact, there's bruising below your eyes that will also come down. Yeah. But you had an experience of a surgery before, first hand, but the jaw surgery, and
Yeah.
even your implants have been removed. By implants, I mean the plate and the
Yeah,
screws.
yeah.
Yeah. We'll go on to take a scan, and we'll also have a discussion over the scan.
Okay.
Okay?
Okay. What about this switcher? It will remove?
Yeah. I just clean.
Yeah. With swelling now or it is
There is swelling. We have
it will
Did you have a look at your previous pictures? I'll show you that once. This is the view we can see maximum difference. Look up a little bit and see yourself in the mirror and look at the alar flare here. Okay, what has been done is you see the shape of the nares or the nostrils. Okay, it has been tucked inside.
okay.
Okay, yes, the tip looks a little bulbous. It's because only this part was pinched. The splint was here. This
that's-
part was open, right?
Yeah.
Also, with respect to the lip, okay, upper lip, work has been done here as well. Work has been done on both the malar region.
Okay.
Okay. I'll show you other views. You can see. Turn on one side and you can see how the nose looks right now. You had a deep radix. There's a depression, and see the elevation is not very smooth. The transition is not very smooth. If you see, there's a depression at the radix, and then it's going all uphill. Right now, it's become much smoother. You can look this view as well. See the nose from the frontal view. It was broad,
Yeah.
right?
Yeah.
You can see there's a hump as well. See? By hump, I mean this. Okay?
There was any block, air block like that.
You did not have any functional issues,
Yeah,
right?
yeah.
But after the surgery, your nose might feel little heavy. You will feel that the pack has come out still. I'm not able to breathe completely. That's because of blood and mucus clogging internally. There are stitches inside,
Yeah.
but those will not be removed. Those dissolve on their own.
Okay.
Okay, so all these things will take time. You might feel my breathing is affected, but that's just a transient one.
Okay.
It will improve.
This switcher automatically it will.
Intraoral, it will dissolve. I'll still check once your healing is good intraorally. Okay,
This implants and all it will.
I'll take a scan and show you.